Hello folks, I'm Dr. Fazil. You're watching October 2024 edition of Dr. Fazil TV show. So the topic of discussion today, folks, is heart palpitations. Like heart is racing or you're feeling your chest is pounding. We call it palpitation. That is a medical terminology. There are so many new cases recently we have seen, and people get dizzy with that as well, or patient get dizzy. So the question is, what's going on and what is the source? And what are the different common causes of palpitation? And what are the risks if you don't diagnose and treat it? And any more side effects which might happen if we don't get it resolved. So let's talk about it, folks. So basically the palpitation is when the heart rate you can feel, right? I mean, your heart is beating around 70 to 80 beats per minute. And if you check your pulse, you will see it is regular. It goes into very in like a rhythmic fashion. But when it becomes very fast, become irregular. Like instead of going like boom, 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 it's going boom, 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 something like that. Then it is known as palpitation, because now you can feel it. So we don't normally feel our heart rate unless we're doing exercise, and we're doing or we're under stress and you see your heart rate is going up. Athletes actually have a lower heart rate because they have a bigger heart, because as you exercise a lot, if you run or walk or do jogging, then you can see that the heart is bigger in athletes, so they don't need to beat that fast. So typically the heart rate in athletes is 50s or 60s, so that's for athletes, but for normal person it's around 70. The heart rate can go up with certain things. The heart rate is controlled by a little portion in the heart known as SA node or sinus, SA node, or is the pacemaker of the heart. So let me bring up the heart model. This is the hologram you can see right here, and I'm going to spin a little bit, spin, and let's hold it right here. So I'm going to tell you the anatomy of the heart a little bit. So we have 4 chambers in the heart. There's right atrium, right ventricle, left atrium, left ventricle. The blood comes from here, and then it goes out from here in the aortic artery, right? So inferior vena cava, superior vena cava, that bring the dirty blood, and then it gets pumped from the right side to the left side, and then eventually it gets pumped out to aorta. So that's a little node on the top known as SA node, and you can see there's a little wiring going. We call it this like wire going to the left side, left bundle, and then we're going to the right side on the right bundle. So those are like electrical tracts of the heart, and you can see that when this pulse generates on a very regular fashion, it travels through from the upper portion of the right heart to the lower portion of the heart, and it goes to the both sides at the same time, and both contracts. You can say it's not contracting, and then the blood is being pumped out. Let's have this hologram go back right in there. So let's bring in an EKG rhythm strip. This is EKG rhythm strip. You can see this hologram, and you can see that this is the P wave, and this is another wave, and then another wave, and they're in a regular fashion. They're coming at a regular time, right? Let's go this hologram go away. Let's bring another rhythm, and you can see this is not regular. You can see there's a lot of fibrillation. We call this atrial fibrillation or AFib, and there are a lot of oscillations in the electrical activity, and the heart beats are coming at a irregular pace. And those things you could feel, right? Let's this hologram go away. Now we can, excuse me. So those are common things, right? So palpitation could be physiological if you're having any fever, anxiety, panic attack, you're having exercise, if you run, your heart rate will go up, right? That's common physiological causes. Abnormal causes would be if your blood pressure is low, the heart rate will try to go up so you can keep your blood pressure up. And that happens generally very quickly, so you never feel it. But now we're seeing it that it doesn't happen that quickly. If you stand up, your blood pressure drops, and it's as a backup mechanism, the heart rate goes up, and then you can feel it. So we call it we're seeing more cases, and some cases are presumably are linked with COVID or long COVID syndrome. We call it POTS syndrome. What the POTS syndrome is postural orthostatic tachycardia syndrome. That's what it stands for, postural orthostatic tachycardia syndrome. You can see the slide on the back of the POTS syndrome and the name. So that's a lot of people asking what it is. So basically, we know that COVID virus is a neurotoxin. It's not just a respiratory illness. That's why you cannot, a lot of people have issue with the smell. Smell is a neurological condition to smell things. Taste, that's also a neurological condition. So we know that it's a neurotoxic virus in addition to respiratory as well. So some people have, effect on the autonomic nervous system, which is actually a nervous system which controls the heart rate. And we have seen, and we presumably that system get affected. And what happened is that heart rate does not follow the general physiological principle, and it becomes too fast when a person stands up and they feel palpitation. So the name has been given as POTS syndrome, which is a subtype of long COVID syndrome. So long COVID syndrome has different versions, and POTS syndrome is one of them. In some cases, we have seen that it was very worse and severe, so we had to, have the patient to go to see a cardiologist, heart specialist, and they had to do, evaluation. And in certain cases, the heart rate was changing so abruptly or going so low or so high that they had to have pacemakers.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Again, POTS syndrome is not the only source of palpitation. It could be also atrial fibrillation, which is also a very serious condition. If you do get diagnosed with atrial fibrillation, besides controlling the heart rate, sometimes we recommend, most of the time we recommend blood thinners, because if you don't, you can get a stroke. So let me show you how does that work. So you can see there's a heart, and if this is a fibrillation, this is a hologram, right? So we got this hologram, and now we're seeing this heart is in atrial fibrillation. So you can see this ventricle is not contracting in a regular fashion, but it's contracting fast because of the right atrium, which is the top right upper corner, is contracting fast because of the pacemaker of the heart. The SA node is generating pulses irregularly. And that what happened is that the right atrium, which is the upper right portion of the heart, is stagnant. When it's stagnant, because it's not contracting properly, the blood can clot. And this clot can pass, you can see from the right side to the left side, and then it can go to your brain, right? You can see this clot is going to the brain. That's the hologram of the brain right here. And this clot is going, and it causes plugging into the brain, and it can cause stroke, which can be very, very bad. So that's why we recommend taking some kind of blood thinners, so like Eliquis or warfarin or Coumadin, in most cases. Sometimes if it is low risk, it could be aspirin, but you have to take a blood thinner, otherwise there would be could be a complication like stroke. So folks, that's like few causes of palpitation, POTS syndrome, physiological causes, and some other cases, like if you have thyroid is very high, if you have high thyroid function, that also can make the heart rate to go up. So it's not just, it's also if you have anemia, low blood count, anemia by itself can cause tachycardia. If your blood pressure is low, that can also cause palpitations. So palpitation have multiple reasons. So, physiological, exercise, stress, anxiety, panic attack, other non-cardiogenic or not heart-related conditions like low blood pressures, pain, anemia, low blood count, low blood pressure, certain medications, for example, certain illicit drugs like cocaine that can also make your heart rate to go up, Then there are pathological conditions, for example, PART syndrome, which is postural orthostatic tachycardia syndrome related to long COVID syndrome, has been seen recently more and more since the time is passing away from the initial episode of COVID epidemic. So we're seeing a long-term side effects of COVID infection. So the idea is that the COVID did not only cause respiratory problem, but also neurological problems as well, including cardiogenic, like heart-related issues as well. So atrial fibrillation is AFib, we call it AFib. That's another source of palpitation. So if you do feel that you have palpitations, don't ignore it. Please, folks, see your provider, get it checked out, make sure it is something you don't, it's not serious and you need certain more intervention, then just don't ignore it. So that's my advice. At that note, this was Dr. Fazil's TV show. Folks, have a nice rest of the month. I will be back next month with more important topics for your health, and God bless you and God bless America. Dr. Fazil's TV show here. Thank you so much.